Thank you for joining us virtually for a press briefing. My name is Kelly Chandler, the Public Health Division Manager for Itasca County. We are hosting press briefings in Itasca every other Thursday to address COVID-19 related issues and questions. And today our focus is on our schools, activities, and COVID within our youth. We'll hear from our Itasca County Superintendents today, along with our Director from Northern Lights Community Schools. Before we introduce them, we'll discuss the status of COVID-19 and vaccinations in Itasca. Our eligible population for vaccinations is anyone ages 16 and up. And for this group, we're at 47% of our residents who have began their vaccination series, and over half of these have completed their series. We have 78% of our 65 plus population vaccinated, and we do encourage anyone 16 and up to seek out a vaccination at our pharmacies, hospitals, or public health. Public health will be offering a Saturday clinic for those who work general business hours. It will be held at the IRA Civic Center in Grand Rapids on April 24th from 10 to 2. You are able to register via a link on the Itasca County website, and if we do have enough vaccinations available, we will offer walk-ins that day. The latest information on the Johnson & Johnson pause due to 6 serious but rare cases of blood clotting out of 6.8 million persons vaccinated has gained much media attention. This does show the robustness of the U.S. surveillance and safety system. We've been told it will be a few days to weeks for the investigation into these cases and to identify and treat any new cases. Johnson & Johnson was only 6.6% of the vaccine utilized in Minnesota. No side effects of the clotting issues were identified in our state. If you are over 3 weeks out from receiving a Johnson & Johnson vaccine and you've had no adverse reactions thus far indicating clots, you should not be overly concerned. For those who are within your 3 weeks of receiving Johnson & Johnson, monitor for headaches, abdominal pain, leg pain, or shortness of breath, and seek out healthcare for evaluation. These side effects of clotting have not been linked with Pfizer or Moderna vaccinations, and we still strongly encourage anyone who is wanting to receive the Johnson & Johnson to instead seek out the other available vaccination options. Vaccines have been offered or will be offered within our area high schools for 16 to 18-year-old youth. And our hospitals have offered these vaccinations as they are the ones who have the Pfizer available to them. And we're so appreciative of this partnership between the hospitals and schools. For parents who are still interested but may have missed the opportunity for your child to be vaccinated, please call Grand Itasca, Essentia Health, or Thrifty White, as they all have the Pfizer available to them. This opportunity for our youth really highlights the collaboration we have amongst all of our vaccinators in Itasca and our mutual goals of reaching herd immunity. Pfizer has submitted its emergency use authorization request this week for our 12 to 15-year-old youth, and it's making their way through the national approval process. Decisions should occur within the next few weeks, and we're especially excited because we know the B117, the UK variant, is in Itasca, and it's linked to spread amongst our youth and their parents. And we're really in a race to get these vaccines out before more spread occurs. So what does it mean when youth are fully vaccinated? And our superintendents may touch on this as well. They won't have to quarantine for close exposures. They won't have to miss their in-person learning, their athletic events, band and choir concerts, proms, and graduations. And we know this will be the case for at least 6 months post-vaccination, which is up from 90 days. And the research on length of time vaccines are effective continues to be conducted, and it very likely will extend beyond 6 months. We know the vaccines are effective in preventing severe illness and hospitalization. Unfortunately, our case numbers have been on a steady increase in Itasca since late February and early March. In the past 7 days, we've identified 114 new COVID cases and 197 in the past 14 days. Our 14-day case rate per 10,000 was down at 15 in February, was at 42 at the end of last week, and as of April 12th, we are solidly at 48. Cases are highest amongst youth and their parents ages. And I know we're all tired of the pandemic. We're tired of talking about COVID, but we do ask that you continue to stay 6 feet apart from others, wear your masks. We know this works to prevent spreading of COVID-19, particularly to those most vulnerable or who will not simply have mild symptoms. Sadly, we have had an additional death this past week due to COVID-19, and it was in a gentleman in his 80s. COVID has not left us, and we need to stay strong, especially to protect those who are unvaccinated or are more likely to experience poor outcomes. I'll now introduce our speakers, and we will hear from David Pace, Superintendent of Greenway Public Schools, Mike Hamernick, Director of Northern Lights Community School, Dr. Jeff Pestga, Superintendent of Deer River Schools, and Matt Gross, Superintendent Grand Rapids and Big Fork Schools. We will now hear from David Pace.
Good morning. I'm David Pace from Greenway Schools. Currently, we are in an in-person K through 12 setting. All our students have been in person basically since February 8th. We've been very diligent within our school district to make sure that we've had in-person learning. Our compliance as far as overall masking, limited movement, and maintaining the social distancing within our classrooms, whether it be 6 foot or 3 feet, have been able to make us very successful in this in-person effort, as we have only lost 13 school days to in-person learning. So again, I congratulate our staff and our students in that situation to make sure that we've been in person, whether it be in person or hybrid learning throughout this school year. Their persistence and making sure that students are compliant within, the rules and regulations that we can have allowed us to be very successful. That does not mean that we haven't had our challenges, throughout the school year. 1 week ago, as the county did see increases, we did see increases of activity within our school community. About a week and a half ago, we had about 120 students out on quarantine due to close contacts. This week, we have seen a significant drop. We are only at about 30 students that are home due to close contacts within, their quarantines expired, and we have not had any students sent home this week due to close contact issues. So we're continually asking our parents to be compliant, along with our students within the school buildings. Parents, if you have students that have symptoms, please keep them home. If you have a pending test within your home, please keep all your students home and do not send them to school. We've got a very short period of time left in school. We want to finish successfully, and it is a joint effort between what we do within our school buildings and what happens out in the public to make that successful. Thanks.
Thank you. And we will now hear from Mike Hamernick, Director, Northern Lights Community Schools. You're muted, Mike.
Oh, I had to be the one. I had to. All right, I broke the ice for everybody. So as I was saying, I am Mike Hamernick at Northern Lights Community School. We're a small charter school located in Warba, and we are a 6 through 12 program. And at the moment, we have about 92 students enrolled. So we're a very small program compared to most of the others that are represented here. We've actually been in full distance model since March of last year. However, for this fourth quarter of the school year, starting on April 6th, we did bring students back in a hybrid model where they're coming, half the students are coming every other day. And I will say that we are a building that's big enough, and with only 92 students, there's really no reason that we can't have all of the students here right now. The only reason we are in a hybrid model is due to transportation. There are limits placed on the transportation that we contract with. We don't have our own busing system. And due to that, we have to bring in half the kids every other day. So if things change in that side of things, we will bring more kids in, and hopefully by the end of the year, we'll have all of our students here all at the same time. Anyway, so yeah, because we've been in a distance model for most of the year, we really haven't seen any issues. And right now, nothing's really popping up with us. The students are being very good about wearing their masks. I believe we have over 80% of our staff are vaccinated. The compliance with that was very good. And all of the staff are present and accounted for and working on a daily basis. So things are going well for us. And as long as people play by the rules that have been established, I think we're going to finish this year on a good and healthy note.
Great, thank you. And we will now introduce Dr. Jeff Pestga, Superintendent of Deer River Schools.
Good morning. We'll start at high school here. Similar to the other schools you'll be hearing from, we're moving into spring sports and planning for concerts, prom, and graduation. And those are proceeding, putting precautions in place with some modifications. And we're optimistic that we can have some version of those. We also have had the opportunity for students 16 and plus to begin receiving the Pfizer vaccination. We'll actually have a couple of students on Friday receive their second dose and be fully vaccinated. But as far as we're aware, there are about 10% of our students that are eligible, 16 plus, that have now begun the vaccination process. So a lot of room to grow there, and we're hopeful that trend goes in the right direction. And the big story here is we came back April 6th from a short spring break, and we have definitely seen an increase in the impact of COVID, primarily at the elementary level. So right now we had, since April 6th, so we're not even talking a full week yet, we've had 50 students that needed to go out on quarantine due to close contacts at King Elementary. There were 4 positive cases there. At the high school, there have been 0 positive cases since we come back from break, but primarily through transportation, we've had to quarantine 15 students due to close contacts. There went my chair. And the staff, we've actually had 20 primarily support staff that came back from the break and needed to be quarantined due to close contacts outside of school. And there were 2 positive cases within the staff. Obviously our break had an impact, in particular the adults and the younger kids coming in and being in tighter quarters because we are in person. At the elementary, the primary grades, students are spread out as much as we can, but they just, even though they're good about wearing masks, they're just more tactile and tend to group up a little bit more. And then the buses is really our limiting factor right now because our students are so dependent on bus transportation that when we're full in person, we can't space them out enough so that every time there is a positive on a bus, it usually yields about 7 close contact quarantines. Other thing, and this is not from a health practitioner's perspective, but what we're hearing from our COVID coordinator, our school nurse, is that the symptoms being presented by these primary grade students look a little bit different than what adults were demonstrating for symptoms if they're susceptible to COVID. And it's kind of like a subset of that, sneezing, fever, and actually nauseous, which was something that we didn't see in adults and has been going on here this last week. So it'll be an interesting challenge here for the next week or so with those primary grades.
Thank you. And we will now hear from Matt Gross, Superintendent, Grand Rapids and Big Fork Schools.
Morning, everybody. We continue to hear how grateful people are that as a system, we've been able to be in person for most of the year. Like Greenway, it's been a lot of work and been challenging, but just something we prioritized. We're also hearing that the quarantines that my peers have mentioned have been challenging for families, and there's frustration building, it seems now, around that and around masking. And I just want to let folks know that we're doing our best to keep our learning environment safe and following the rules that we need to follow. That's sort of the trade-off of being in person, that there's tighter restrictions, and if we want to be in person, there's some consequences to that too. So we're in a weird space right now where we're trying to keep kids here, but also recognizing that. When we start thinking about exciting or bright spots, I think we always look at our students first, and there's no shortage of those bright spots. Our kids are awesome, and they're in many cases way more resilient than we tend to be as adults. If you come to one of our schools, any of the schools that are on the call today, I think you'll see kids doing school with masks, and in many cases just have adjusted to a new normal. And absolutely, we're all looking forward to the day when masks aren't part of that, but our kids have just made that adjustment and they're happy to be around their friends. And we're also seeing evidence that there's a great deal of learning going on, and our efforts to ramp up intervention programs are paying off with closing of gaps. And that's something that we're going to continue to work on this summer. I want to acknowledge the hard work of our staff as well. We get into this business of education because we love children, and it's been incredibly hard, but we're privileged to be able to do that, and privileged to be able to continue this year in person. We've had a good number of student activity groups that had great winter seasons and have received recognition, which is great. And whether they're music, sports, or FFA or anything else, we know that those things help our kids maintain a little bit more normalcy. And those activities help connect them to school and provide an outlet for energy and stuff like that. So grateful for that. And like my peers said, heading into spring, we've got spring activities rolling right now, and that's a good thing too. We're grateful to be able to partner with Essentia Health in Big Fork Valley to offer vaccination clinics in our high schools coming up, or to our high school students. And that's something that we do as schools. We provide opportunities or space for flu vaccine clinics and eye checks and scoliosis checks and all that stuff. That's just part of what we do in schools. And so our community partnerships like that help us keep kids healthy, and as a result, our community healthy. And like Dr. Pestga said, having those kids vaccinated now really changes the game a little bit when we're talking about graduation and prom and things like that. We know that we're going to be able to be even that much more safe then. As far as the springs, we've got in-person plans for graduation and prom, and we're hopeful that we can continue with that, and that we can keep kids healthy and our community healthy enough to pull that off. They're going to be limited in capacity, but if we think a year ago, we weren't able to do either of these things. So it might be different, but at least we're able to do those. And we're busy planning for summer programming right now as well. A lot of summer school plans, and also how we're working through budgeting our COVID funding that is here or coming our way. And I'd echo David's comments about just, we need our community here for the last 6 weeks of school to partner with us, buckle down, finish strong, enable us to finish the rest of the year in school. And that means keeping your kids home when they're sick, masking up, being distanced, washing hands, all that stuff. But we know we need to do. So thank you.
Thank you. And we'll now move to our question and answer portion of the briefing. And we ask that our media submit their questions via chat with their name and the organization we represent. And we have our first question. Jennifer Vale Stores, ICTV. What has been the response for students at Grand Rapids High School who are 16 and over? I know there were 108 doses of Pfizer vaccine to be given away. Are all of these slots filled?
I know I just talked to our kind of liaison here at school. 84 of the spots are filled with students right now. And then we have a couple, they're in doses of 6 because that's what's in the vial. So we're into our next vial here of whatever that would be, 85 to 90. And we've got a couple slots filled in that next vial. So, we've got about 20 doses to fill yet.
Did we want to hear from our other schools on how your response has been? Greenway or Deer River?
I know Greenway got just a few over 30 vaccinations. I think we had a few that were open, but I think overall, as the first vaccinate, and I think as we saw in the public, it took a while for those people to become accustomed to getting vaccinated. So I think we're at a point where we're just at the starting point. We're looking forward to the next step. So I think there was, good, I would consider it a good success at a starting point, the first vaccination clinic that we had. So look forward to the next one.
River.
And I can just follow up. I did share that we were about 10% based on our estimate. So we've had 3 clinics, including one that we hosted here on Tuesday with Essentia Health at our high school. And with those 3 clinics, excusing students or providing transportation for students to those 3 clinics, we estimate that we're about 10% of our 16 plus students vaccinated. We'd rather have that be 99%. So we've got a long ways to go. Visiting with students, they are really slow to be motivated that this is their pathway to normal. I think if you told them they couldn't do something that they wanted to do on a certain day, they would walk down to the gym and get vaccinated so they could do it, but they have a hard time looking 6 weeks ahead. There's a disruption with the J&J supply and the safety follow through right now. Potentially a one-shot vaccination might get a lot more of the middle school, high school age kids if it ever becomes available for them, rather than having to commit to a long period of time. That's hard to get students of that age to commit to on anything in that time frame. So we've got a long ways to go, but yeah, I'm happy to have the 10%, and we'll go from there.
Do we know of any vaccinations occurring with Northern Lights schools?
I don't know. No doses were allotted to us that I'm aware of, so I have no idea unless I polled the students and their parents. So.
Sure. Yeah, and just to piggyback off our superintendents, we are seeing that in adults as well, where maybe they didn't choose to be vaccinated early on, but once they see that their peers and their coworkers or becomes more readily available, we have seen more folks come along. So we're certainly working on that and pleased with that. Other questions? Okay, seeing none, we will end a little bit early. Thank you so much for joining us today for this press briefing.
UPM leads the integration of bio and forest industries. Our constant aim is to produce more with less. That's what Bio4 stands for. Paper is true Bio4 product made of renewable and recyclable raw material. It remains sustainable throughout its whole life cycle. UPM Bio4, beyond fossils.